The open enrollment period to review your Northwestern benefits begins on October the 23rd at 8 a.m. and ends on Friday, November the 10th, 2023 at 5 p.m. In this presentation, we'll define what open enrollment means. Then we'll cover what is changing and what is not changing, followed by an overview of the health, dental, vision, FSA and HSA plans. Finally, we'll cover the requirements for the changes to life insurance and the LTD plan. If you are a Northwestern faculty or staff member, open enrollment is your opportunity to review coverage options for the coming year and choose the benefits coverage you want and benefits coverage you and your family need, beginning January 1, 2024. You make all your changes online via the MyHR portal by selecting the Benefits tile. Let's talk about what is changing. Premiums for your PPO health plans are increasing 5% for all tiers due to high medical claims and medical inflation. In recognition of the financial pressures many of us feel, the university increased its contribution percentage by 16 to 31%, depending on the tier. The PPO dental premiums are increasing, also based on the premium tier. It has been several years since the dental plans have increased. Now, in good news, the vision plan premiums will decrease. Be sure to check your coverage and salary tier to locate your new premium. These new premiums are in the Open Enrollment Guidebook and also in the MyHR benefit system once you've logged in. The standalone vision plan, IMED, is now being managed through Blue Cross Blue Shield of Illinois. The benefit and the IMED network will remain the same. The Blue Cross Blue Shield of Illinois IMED Vision Plan offers comprehensive coverage with a $10 eye exam copay, allows for eye exams once every 12 months, as well as new frames and contact lenses once every 12 months. IMED has a large national network of providers, and you can go to any optometrist to receive coverage. But you will receive higher benefits for services from a provider who is a member of the IMED provider network. Because enrollment is now managed through Blue Cross Blue Shield of Illinois, the cards will be issued and mailed to you by Blue Cross Blue Shield of Illinois. Let's move on to a deeper overview of the vision plan changes that might not be obvious. Beginning 1/1/24, Blue Cross Blue Shield of Illinois will administer the plan, while IMED will continue to provide customer service and claims administration. This means that all employees registered for the IMED Vision Plan in 2024 will receive new cards in the mail displaying the Blue Cross Blue Shield logo and account information. Make sure you don't use your old IMED cards. You can still use the IMED network called the Insight Plan and receive the same discounts on the exam fees, lenses, contacts, and frames in the same year. Now on to what is not changing. Our plan design and premiums for our life and LTD plan, as well as the HMO of Illinois medical plan, are not changing. In fact, the HMO Illinois premiums have remained the same and the Guardian DHMO dental premiums have decreased. For your prescriptions, be sure to check the formulary list on our website as pricing may have changed. There have been no changes to the tuition plan nor any of the tuition benefits offered. Make sure to check our website for the most up-to-date information. Also, there are no changes to our discount program through PerkSpot, nor are there any changes to the pet insurance program or the commuter benefits program. Check the Wildcard Office website for any wildcard updates. Now to our health plans. We continue to offer 4 medical plans administered by Blue Cross Blue Shield of Illinois. The Premier PPO, which has the lowest deductible, coinsurance, and out-of-pocket maximum for the highest premium. The Select PPO, which has a higher deductible, coinsurance, and out-of-pocket maximum for a more affordable premium. And then the Value PPO, which is a high deductible, low premium plan with an associated HSA with matching university funds. Potential out-of-pocket expenses vary by plan and also vary by services received from Northwestern medicine providers or from in-network or out-of-network providers. These PPO plans offer the flexibility to go to any provider you choose, and if you choose to use Northwestern medicine providers, you receive a higher level of benefits coverage with the lowest out-of-pocket costs. We also offer HMO Illinois, where you receive 100% coverage when using the HMO Illinois provider network. HMO Illinois pays no benefits if you go out of network, and this plan is not part of Northwestern Medicine Tier 1 providers. All 4 medical plans pay 100% of the cost of preventive care. All 4 medical plans also provide prescription drug benefits through Express Scripts. Whichever plan you choose, you can enroll in coverage just for yourself, or you may include one or more eligible family members under your coverage. Here is a look at the monthly health premiums. They are based on your salary. Remember, if you are paid bi-weekly, the premiums are halved and deducted per paycheck. The new premiums can be viewed online when enrolling via MyHR. They are also in the 2024 guidebook. We continue to offer 2 dental plans, Guardian DHMO and Blue Cross Blue Shield PPO. These plans have not changed their plan design. The Blue Cross Blue Shield of Illinois PPO dental plan has higher premiums, but offers flexibility to go to any dentist in or out of network. You also receive higher benefits coverage for services when using Blue Cross Blue Shield of Illinois in-network providers. The plan covers the full cost of preventive services twice a year when using an in-network dental provider. If you choose to enroll in the more affordable Guardian DHMO plan, you and your covered family members must each select a primary care dentist who participates in Guardian's managed care DHMO plan. You may only receive services from your nominated dental provider under this plan, and this plan is only for those who live in Illinois. The premiums for this plan did not increase this year, and this plan also covers the full cost of preventative services twice a year. Healthcare FSA requires you to re-enroll every year. Use these tax-free dollars to help pay for your eligible healthcare expenses incurred by you or your family members. If you are enrolled in the Premier PPO, Select PPO, or HMO Illinois plan, you can contribute to a traditional healthcare FSA plan. Or if you enroll in the Value PPO plan, you can contribute to a limited use healthcare FSA plan. You determine how much to set aside as an annual pledge from $240 to $3,050, then use these funds to help pay for out-of-pocket expenses like physician office copays, prescription copays, or dental and vision copays. PayFlex is the administrator. Remember, this is a use it or lose it plan, so planning is key, as these funds do not roll over and are not portable. So you'll want to pay attention to the deadlines for filing claims. The Health Savings Account, or HSA plan, requires you to re-enroll every year, but this is only a plan for those enrolled in the Value PPO plan. The IRS places restrictions on employee contributions to this plan as well. For 2024, it is $4,150 for single and $8,300 for family. You may use these funds to help pay for qualified healthcare expenses for you and your family, including deductibles, copays, and eligible services not covered by your health plan. PayFlex is the administrator of this plan, and the funds will roll over year to year and are portable if you leave Northwestern. Northwestern continues to offer a limited matching contribution to the HSA account. If you elect you-only coverage, Northwestern will match up to $1,000. If you elect family or you plus spouse or you plus children coverage, Northwestern will match up to $2,000. Remember, you can contribute additional pre-tax dollars via payroll deduction into this account up to the IRS limits, but Northwestern will only match up to the set contributions already described. You can also make changes to these amounts throughout the year via the MyHR benefit systems without needing an IRS life event. The Dependent Care FSA account is a pre-tax savings plan used to help pay for qualified dependent care expenses such as preschool, daycare, summer day camps, before and after school care. This plan is available to full-time benefits eligible employees whose spouse is also working full-time or is a full-time student. This plan requires re-enrollment every year. Qualified dependents are typically your children 12 and under, but can also be used for children with disabilities over age 13. They just have to be declared as dependents on your tax return. Expenses must be incurred in the calendar year in which they were made, from January through December for 2024. The minimum annual pledge amount is $240 and the maximum is $5,000. This is also a use it or lose it plan and does not roll over. If you are enrolled in the Dependent Care FSA plan, Northwestern also offers a matching contribution. The university will reimburse the match directly to your paycheck as earnings, and the amount is equal to a percentage of your contribution based upon your annual pledge and your prior year's adjusted gross income from your tax form 1040. To be eligible for the university match, you must be a full-time employee with a spouse also working full-time or studying full-time, and your combined adjusted household income is $130,000 or less. The match application form must be submitted annually online via MyHR. Regarding the basic term life insurance plan, during open enrollment, you may change from the no-cost automatic coverage of $50,000 to the 2.5 times salary up to the max amount of $250,000 or vice versa. You can also enroll or increase coverage amounts for your supplemental term life plan or your spouse and dependent term life plans. Any changes you make would require completion of the EOI, Evidence of Insurability form, and is subject to vendor approval. This is the time we encourage you to review your beneficiaries. For the long-term disability plan, you may enroll or waive the 10% buyout plan during open enrollment. If you are enrolling in the buyout plan, then you must submit the EOI form online, and this is subject to vendor approval. As a friendly reminder, you must re-enroll in the Healthcare FSA, Limited Use FSA, Dependent Care FSA, and HSA accounts every year at open enrollment. This is because our plans do not automatically roll over year to year, and we do not know what your out-of-pocket expenses needs are year to year. It is extremely important to review who you have named as your basic term life insurance beneficiaries and to make any changes needed. To review beneficiaries for your 403B retirement plans, you'll need to go online to the Fidelity or TIAA websites directly. Remember, open enrollment will end at 5 p.m. on November the 10th, 2023. Remember that Dependent Care FSA match application forms are submitted online via MyHR, and you must upload any dependent verification documents directly into the online enrollment platform. For any general questions concerning open enrollment, contact the Ask HR Service Centre at 847-491-4700 or send us an email at askhr@northwestern.edu. Lastly, we encourage you to visit the benefits website at hr.northwestern.edu/benefits. It has the most up-to-date information and is the best place to research all of the plans we offer in more detail. We thank you for your attention.